Hi, I'm Jesse Newman, and we're back again with Consult with a Professional. As you've heard for the past 15 minutes, we've been discussing with Dr. Fred Barr, a noted plastic surgeon in the Palm Beach area, all about the ramifications and the desires and the fulfillment of people who have always thought of, and then they went ahead and did plastic surgery. Now, Dr. Barr, let's say I had my eyes done, and what's a period of recuperation? How soon can I get back to work and walk among people and not be self-conscious that I have had plastic surgery done on my face?
Jesse, I think the best answer for that is to say that each person has their own individual time course for healing. Usually what we like to say, what I counsel my patients, is that for eyes, probably anywhere between 3 and 10 days you should be ready to get back into the public. There may still be some residual swelling, some residual areas of black and blue, but for the most part you should be functional at that point. Basically, again, it really depends on your own healing pattern, which is predicted by your genetic structure. And unfortunately, we can't predict the absolute finite points of healing for you. That's something that's taken day by day.
Tell me, I know you don't have any kind of guarantee, but if I did my eyes and my eyelids, for example, which is, as you said, the most common of all plastic surgery procedures, do you think that down the road, 4, 5, 6, 8 years, I'd have to do it again?
Usually the eyelids themselves, excuse me, the eyelids themselves are one of the areas where repeat surgery is probably not as frequently done as others, such as for a facelift. The longevity of eyelids, again, depend on how you live your life. If you genetically structure that your aging process is rapid, if you have certain disorders of the skin and connective tissue, if you're a smoker, if you're a drinker, if you stay out late at night, all of which I'm sure you don't do, all these things can obviously cause problems of contributing towards the aging process. And these are the things that we can control. Your genetics and how you age, probably you can't control.
But is there a possibility that if my eyes were done, I'd have to do it again down the road?
There is always a possibility. Again, as you mentioned at the beginning, there is no guarantees. And one of the things that we try to express with our surgery is that medicine is still an art form. It is not an exact science. If medicine were an exact science, it would be very easy to draw up a contract and treat it like any other business. Unfortunately, it is not, and we can't predict or control many of the aspects that we do. What we try to do is load the dice as much in our favor as possible and have an awareness of our problems. And this involves the training period that each of us that are certified goes through to try and see the depths and ranges of problems and various situations that we may encounter, and then be able to deal with them. So the best guarantee that I can tell you is that all of us that are certified will try their very best to perform and do for you what is the right thing.
Now, Dr. Barr, I would like you to tell me the difference between a skin peel and plastic surgery. And also, the second part of that question, do we men, when we shave every day, is scraping away our whiskers and scraping away dead skin hold us in a better position than women who don't have that advantage?
Good questions. I think that for the first part, let me define plastic surgery. Many people think that plastic surgery is the insertion or the use of plastic materials. Plastic actually comes from the Greek word plastikos, which means to change or form. So the misnomer that plastic surgeons use some foreign material is really an unfortunate misnomer. What actually we are surgeons that will change and form those areas of skin and soft tissue and bone that we can work with. Chemical peel is a procedure that is within the realm of the plastic surgeon, and what it is a controlled burn of the skin. You say to yourself, well, how come if I'm out in the sun and the doctor says not to be out in the sun, what is the difference between a sunburn and a chemical peel? Well, a chemical peel is more intense than a sunburn. It is a controlled burn and can lead to problems if it's not done correctly. So there is a amount of material that needs to be discussed between the patient and the physician regarding a chemical peel, And it can be very useful in certain circumstances to relieve or improve the fine wrinkling around the mouth and eyes and forehead. As far as shaving goes, I think that the irritation that's provided by the razor is something that we must consider. Whether or not it actually is acting as a dermabrasion, which is another technique that we do in plastic surgery, is questionable. I don't know whether or not it's a matter of shaving that makes the difference between men and women, as it is the hormone structure. And I think that the hormone testosterone is the one that probably causes the major difference between texture of men and women and the skin, as well as estrogen. Estrogen promotes a smooth, fine skin. Testosterone, on the other hand, promotes more of a coarse, thick skin, as well as a bearded skin. So those are the differences I think that we're looking at rather than the actual outward appearance.
That was great. Thank you, Fred. You know, you don't have any market area. And we in business all know that the first thing you think of is a market area, and the fact is that you've got this patient of yours here at the Brazilian Court Hotel whom you're visiting right now from out of town, who came down for the holiday week and is spending it here recuperating after you did her job. Do you think that a market area is important? I mean, you do have patients locally, you have them from out of town. Do you think that you don't have to advertise? Is it all word of mouth? Do you feel your reputation has reached a point where you now, the biggest source of information is from former patients? Am I correct?
I agree with you, and it's a very difficult area. I think that there's a common conception among patients that we are first physicians, and certainly that is how I view myself. I've been trained, and my background is as a MD, or medical doctor. So I am first a physician. The surgery part certainly took years of training and to reach the point where I've become board certified. That also is part, and it is very difficult in this day and age, as you say, to get a marketplace or to create a marketplace, because people, for one, are not used to the fact that a doctor would go out and advertise, so to speak. I'm not sure that the word advertising is correct, except that what we are trying to do is get across that if you are looking for surgery, what we recommend and what's recommended by the board, the American Board of Plastic and Reconstructive Surgery, as well as the Society for Sane, is that you find those that are board eligible and board qualified to perform this type of surgery for you. They have had the training and they are the experts in this area, and I think that is the advertising that I would wish to get out. I think that only by word of mouth from satisfied patients are you going to ever build your practice.
I think we're now approaching probably the most often asked questions about your profession, and that's the price.
I think that patients do shop. I think that it's probably, again, as we look more and more at everything in a business sense, it is healthy to shop. I think one thing, though, that patients should understand is that not necessarily does a discounted price mean that the quality and the care and skill is going to be not discounted. I think that it is an unfortunate thing where somebody feels that they're getting a good price and then ends up with surgery that is less than good for whatever reason. So again, prices can range in variable amounts, anywhere from maybe $1,500 up to $7,000 or $10,000, depending on how many procedures are performed and what is performed. I think that it is something, again, that should be looked at with the particular patient and physician, something that should be talked about, and oftentimes in my practice we make arrangements for payment plans and the like.
I can't tell you how enlightening the program has been today, Dr. Fred Barr, and thanks to you and your expertise and your erudite way of explaining the procedures that up until now I think have been quite vague in people's minds, and hopefully this program has caused you, the viewing audience, to feel a little bit more comfortable on the subject of plastic surgery. I'm Jesse Newman, and it's been a great experience for me to bring you Dr. Fred Barr today. Hopefully you'll be watching every week, and it's been a great pleasure. Don't go away. Thank you very much.
Thank you, Jesse.